The following segment on Eyewitness News is sponsored by Living Well.
And welcome to today's edition of Ask the Expert. I'm Shay Paul, and I am being joined by my friend, Dr. Jared Chapman of Living Well. Dr. Chapman, it is always a pleasure seeing you.
Good to see you today.
One thing I always notice about you is the fact that you never seem to age. I've known you for a very long time, and you're ageless, and your skin always looks great. And I know one of the things that you focus on at Living Well is encouraging your patients to develop a good skincare routine. And so I was hoping maybe you could give us and our audience some pointers today.
So there are four basic pillars of good skincare: to cleanse the skin, exfoliate the skin, moisturize, and then protect the skin. And so I think if you follow those four simple steps, you can really help your skin to look healthy and stay young looking longer. Exfoliation and cleansing, is the first pillar of good skincare, and we recommend a good cleanser that's appropriate for your skin type. You can come in and we can assess the skin type that you have, or you may already know the skin type based on just simple common sense. If you're oily, or if you're dry, or if you're a mix of those two. But anyway, the cleanser should be based on the skin type of the patient. A lot of people just have what we call normal skin, which is a blend of oily and dry in the areas which are, the T-zone, which make
Right.
it a little oilier,
Right.
and then the lateral aspects of the face, which gets a little
cheeks
drier.
a little drier, right.
Sure. So that's more of a mixed type, and that's where most people fall. So we have some great cleansers here through the Skin Medica line. We have one in particular that's called the AHA BHA, or they call it the AHA BAHA cleanser for the abbreviation, which is really good to both because it has both lactic acid and salicylic acid in it. So it will brighten the skin. Plus, it will also treat any excessive oiliness and helps with skin breakout. We have great exfoliators. That has a little bit of an exfoliator in it, but we recommend really exfoliating the skin about twice a week to keep the dead skin cells moving off the top layer of the skin, the epidermis. And then, moisturizing the skin. We use several different things for our moisturizers, from serums to classic moisturizers, to something in the skincare line that we carry, the Skin Medica, is called HA5, which is a hyaluronic acid. It occurs naturally in the skin. It's what we use as our filler product when we're doing fillers, and we're applying this topically to the skin. It's one of the best preparations over the counter you can get for your skin. It's fabulous. It keeps that dryness down. And for those who don't want an excessive heavy moisturizer, this is awesome. We also use a lot of serums in our treatment, and then that goes into the incorporation of the moisturized phase. So if you nourish the dermis, it will produce healthier cells. So this is the area where the retinols get applied, the retin A gets applied, and then the moisturizers, the topical moisturizers get applied. And then the fourth step, of course, is sunscreen. And we really want to make sure that we protect the skin from the sun. It is the number one cause of premature aging, for wrinkling the skin, and for enlarging the pores. So if you really want to keep your skin looking healthier longer, you will protect it from the skin, both with a chemical barrier and a physical barrier, meaning there are sunscreens out there that do both, and then plus applying, wearing a hat and protecting your skin when you're in the direct sun. A lot of people don't realize when they're around water, the water amplifies the rays of the sun because the sun is bouncing off the water plus coming directly in. So it's really good to make sure when you're at the beach or you're at the pool or you're on the boat to really use a lot of appropriate sunscreen. Should be SPF 30 or higher to really protect the skin.
And I think we need to dispel the myth also that you do not need to wear a sunscreen in the winter. A lot of people think hey, there's, no sun. Why do I need a sunscreen? But that is not the case, correct?
That is correct. Those UVA and UVB rays are still coming through, and we're still being exposed to the things that damage the dermal cells and the epidermal cells. So it's definitely, sunscreen should be worn all the time. For ladies, it should be worn under the foundation as part of, I know their makeup, a lot of the makeup has SPF in it, but I still advise applying a good sunscreen as a base before you apply your makeup. And for men, they should keep it on them all the time as well if they want to keep their skin from aging.
Okay, all great advice, Dr. Chapman. Thanks so much for being with us.
Thank you for having me.